So my name is Dresden Beier. I'm a podiatric surgeon, which is a foot and ankle specialist. For me, I started out with foot and ankle, an interest sparked in the military. I served as a medic in the Army for 6 years, and during that time I deployed, and during the deployment one of the biggest things that brought patients in or soldiers into the clinic was problems with their feet, because soldiers are hard on their feet. We do a lot of marching, ruck marching, and combat boots, etc., which can lead to a pathology with the foot, such as common athlete's foot to ankle sprains again, and things like that. And so that's where my interest kind of was sparked with the foot and ankle. And then my mom's a diabetic, so that's always been kind of, for a diabetic patient, hands, eyes, kidneys, and feet are common problems. And so, my interest was really motivated for both populations, of a diabetic population to a very young athletic population, and keeping people mobile and ambulatory on their feet, which actually, makes us overall healthy in our lives and keeps us going forward. So my experience in Jackson has been excellent. We moved here from the east side. I completed residency in Detroit area at Botsford Hospital. Came over to Jackson and started working with Henry Ford System in 2015. During that time, I lived in Jackson locally for the year. I still live in Jackson County. We moved down to the Clark Lake area out in the country, which is just south of town a little bit, but for me it's ideal. The hospital focus on community-based services is very important to me. And remaining in the community that I serve was also a key. And the location, I can't complain. It's centrally located. We have a ton of things to do within Jackson. It's always, to me, it's great when I go out to Applebee's and I see a patient at dinner and I say hi, and they see my kids, and my kids get to interact with, my patients and also people in our community. So it's a good example for me, for my kids, but also an excellent opportunity to really be involved as a community member and provide a service that's needed in this area. And Henry Ford, like I said, their vision of patient care is in line with what many practitioners see as, providing good medical services for patients in need, especially in our community.